Greetings. Today's lecture will be about types and forms of prevention of hereditary diseases, medical genetic counseling, clinical genealogical method. Bezrukov Grigory Sergeyevich, Associate Professor, Candidate of Medical Sciences. Sir Francis Galton. He can be rightfully considered one of the fathers of human genetics. He was the famous Darwin's cousin. He dealt with issues of heredity, biometrics, dermatoglyphics, statistics, and testing. He was the first to begin studying twins. He created eugenics, the science of improving the human breed. Their common grandfather is Erasmus Darwin. Darwin is an English physician, naturalist, inventor, and poet, one of the most significant figures of the British Enlightenment. Author of translations into English of the works of Carl Linnaeus, Rousseau, and inventor. Consulting stories. The first genetic consultation were conducted in the USA in 1910 by Charles Davenport. In Moscow in the early 30s, there were medical eugenic consultations organized by Davydenkov and the Medical Genetic Institute headed by Leavitt. A medical eugenic journal was published. In the 2030s of the 20th century, laws were issued in Germany and the USA prohibiting the marriage of persons with certain diseases, which led to the discrediting of eugenics. The Medical Genetic Institute in Moscow was closed. Leavitt was arrested and shot. The term medical genetic counseling was introduced in Sheldon Reed's book Consulting on Medical Genetics. The intensive development of MGK in different countries, including Russia, began in the 60s-70s of the last century. Shortly before his death, which occurred in 1961, Davydenkov began to organize a laboratory of medical genetics. In 1969, by decision of the government, the Institute of Medical Genetics in the USSR Academy of Medical Sciences was created. It is led by Dr. Bachkov. Medical genetic counseling is a specialized type of medical care aimed at preventing the appearance of sick children in families. Prospective counseling is performed before the birth of a child. Retrospective after the appearance of a sick child in a family. The need of the population for counseling. The frequency of hereditary diseases is low. The occurrence of most monogenic diseases is 1 in hundreds of thousands. The most common hereditary disease is Down syndrome. There is a concept of orphan diseases. These are rare diseases affecting a small part of the population. Today, more than 6,000 orphan diseases are known in the world. Most of them, about 80%, have a genetic nature. Government support is usually required to stimulate their research and create medicines for them. Indications for medical and genetic counseling are 1. The birth of a child with a developmental defect. 2. Hereditary disease in a family. 3. Delayed physical and mental development in a child. 4. Repeated spontaneous abortions, miscarriages, stillbirths. 5. Closely related marriages. 6. Exposure to teratogens in the first 3 months of pregnancy. 7. Unfavorable course of pregnancy. During the consultation, the family should receive answers to such questions. What is the nature of the disease? Not every congenital disease is hereditary. How to treat the disease? How does it end? Is it possible for other children in a family to have it, to possess it, to be the carrier of it? The tasks of genetics are: make a diagnosis, to calculate genetic risk, to bring information to the family. An indicator that the consultation was carried out successfully will be the adoption by the parents of a deliberate, adequate decision. Methods that are used in counseling: genealogical, cytogenetic, biochemical, DNA diagnostics, population statistical analysis, dermatoglyphic. Stages of medical and genetic counseling. First visit to the doctor, collecting a genetic history and building a family tree, examination of the proband and his relatives, analysis of the phenotype. Work with literature and computer databases. For the appointment of necessary laboratory and instrumental studies, consultations of specialists, psychological support of the family, and agreement on the next meeting. Drawing up a pedigree. A pedigree begins to be built with a proband, a person from whom the study of the family begins. Proband brothers and sisters are siblings. Each generation is numbered with Roman numerals on the left. Individuals of one generation are located on a horizontal line and numbered with Arabic numerals. Phenotype analysis. The genetics pays special attention to the details of the structure and small anatomical features. Genetics have their own terminology. Here you can see the example: synopsis, hypothyroidism, etc. Examples of development features. The most carefully studied phase, eyes. Here you can see on the left, top left, antimongoloid incision of the eyes, hypothyroidism, telescent. On the top right, you can see the example of epicanthus, rough facial features, like the famous gargulism. The structure of the oral cavity. You can see the examples of the Gothic sky, micrognathia, abnormal bridles in the mouth, oligodontia. The structure of ears. You can see the low set ears, microtia, atresia of the auditory canal, notches on the earlobe. Features of brushes and feet. You can see the camptodactylia, polydactylia, arachnodactylia, the famous Marfan syndrome, brachydactylia, clinodactylia, oligodactylia. syndactyly. Features of brushes and feet. You can see how they look like. Features of feet. You can see the sandal-shaped slit, club foot, rocking foot, Chervetsky-Turner syndrome. These are precise examples. Skin, nails, hair. You can see the vitiligo, nail dystrophy. You can see Menkel syndrome with twisted hair. Dermatoglyphics is being investigated. The features of scallop skin and the main flexure lines of the palms or soles are studied. You can see the three main types of finger patterns: arc, loop, and curl. Flexion fold options. Features of dermatoglyphics in some syndromes: Edwards syndrome, arcs on all fingers; Down syndrome, one flexor fold; Turner syndrome, all the curls on the fingers; Rubinstein-Tabby syndrome, a complex pattern on the tenor. Analysis of the phenotype allows you to make a preliminary diagnosis. But sometimes additional research is required, like karyotyping, DNA diagnostics, consultation with specialists, and work with literature and electronic databases. The second and subsequent visits to the MGC by the family. Making a final diagnosis, in half of cases it is not possible to make a diagnosis. Calculation of genetic risk, bringing information to the family, observation and treatment, in case of pregnancy, prenatal diagnosis. What are the main groups of hereditary diseases? Monogenic or Mendelian diseases, when the disease is controlled by one main gene. Chromosomal diseases, the genomic and chromosomal mutations. Multifactorial, that is caused by many genes and environmental factors. The structure of hereditary pathology. Three main groups of hereditary diseases. Monogenic, that takes about 18%. Chromosomal, that takes about 9%. And multifactorial, that take the major part, 73%. Monogenic diseases. Fermentopathia, defects of individual enzymes like albinism. Dysplasia, violation of the structure of tissues like famous Marfan syndrome. Neurofibromatosis. multiple congenital malformations, syndromes, different tissues and systems are involved. Syndrome from Greek running together, a stable combination of systems. Fermentopathia, a defect of the separate enzyme, for example, phenylketonuria, adrenogenital syndrome. Children are born healthy, but from the first months of their life the clinic is growing. Many forms, many types of inheritance. Dysplasia with mutations of genes expressed in certain tissues, like neurofibromatosis, achondroplasia, Marfan syndrome, ectodermal dysplasia. Children are born with signs of dysplasia and the clinic is gradually increasing. Signs of neurofibromatosis. Fibroids and spots on the skin of the coffee with milk type. Fibroids originate from Schwann cells. Both melanocytes and Schwann cells are derivations of the neutral crest. Multiple congenital malformations. Multiple congenital malformations are the result of mutations of important regulatory of genes with a pleiotropic effect. Beckwith-Wiedemann syndrome. Noonan syndrome is an autosomal dominant syndrome of stunting, unusual phenotype, and congenital anomalies, like pterygoid neck folds, short neck, sternum deformity, congenital heart defects, cryptochildism. Manifests from birth. Beckwith-Wiedemann syndrome is also an example of impaired imprinting. In Beckwith-Wiedemann syndrome, both are paternal and maternal alleles of the gene are switched on simultaneously, whereas normally only the paternal copy is expressed. This syndrome is characterized by excessive tissue growth. There is a large tone, an umbilical hernia, a small sign, notches on an earlobe, and much more. The correct diagnosis allows you to anticipate the development of complications. Consider this syndrome with minimal diagnostic signs like macroglossia, umbilical and hernia, macrosomia, notches on the lobes of the auricles, hypoglycemia. Macrosomia is noted from birth or develops postnatally. Typical feature is vertical grooves on the earlobes. Often there are hemipeterophy and pigmented nevi. Visceromegalia is noted. Hyperplasia of Langerhans in SLED cells occurs. Nephrogenetic blastema occurs in the kidneys, and a sharp increase in the size of cells and nuclei occurs in adrenal glands. There are also two horned uterus, cryptochildism, diaphragmatic hernia, incorrect division of the lungs into lobes, ventricular septal defect, an auditional spleen, incomplete bowel rotation. In 5% of cases of the syndrome, malignant tumors develop, like some types of cancer. Regular ultrasound examination of the kidneys allows you to detect the development of a tumor in time. Risk calculation for monogenetic diseases. If disease is of a family nature, based on a pedigree. If this is a new mutation, based on the population frequency. The proportion of new mutations for some monogenic diseases. Back with Weidman syndrome, around 85%. Achondroplasia, 80%. Neurofibromatosis, 40%. Marfan syndrome, 30%. Huntington chorea, 4%. Kidney diseases, 1%. And others. Take the very small percentage of a total amount of monogenic diseases. 2. Chromosomal diseases. The diagnosis is based on cytogenetic examination. Chromosomal diseases include genomic mutations that are changes in a number of chromosomes, for example, the Down syndrome, Patau, Edwards, Chervetsky-Turner. Chromosomal mutations, changes in the structure of chromosomes, like Cat-Cry syndrome, various forms of translocations, deletions, inversions, etc. Genetic risk in chromosomal diseases. Family cases are calculated based on a cytogenetic picture. New mutations based on population risk. The classic variant of Down syndrome, 95% of cases, is a complete trisomy. The remaining 5% are translocations, forms of mosaicism. Trisomy in all cells is the result of non-divergence of chromosomes in meiosis and almost always maternal. Family translocations in Down syndrome, 2–3%. You can see how it works. When merging gametes, only one descendant out of 6 will receive a normal set of chromosomes. Sometimes the risk is even 100%. For example, when the 21st chromosome is translocated to its homology, the risk of having a sick child is 100%, regardless of which parent is the carrier of the translocation. Three, multifactorial diseases. Due to both genotype and environmental factors, these are the most common diseases, like some congenital heart defects, coronary heart disease, hypertension, diabetes, asthma, psoriasis, schizophrenia, etc. So about 1% of the population suffer from schizophrenia, diabetes, 5%, allergic diseases more than 10%, hypertension about 30%. In other words, that is what you will meet with on a daily basis. The scheme of the development of multifactorial diseases. Here you can see the dependence from genotype and habitat. Example, simplified scheme of bronchial asthma development. Environmental factors that provoke bronchial asthma. Mold, pets, dust, pollen, cigarettes, heat, some perfumes. Conclusion. To determine the risk in monogenic diseases, the pedigree is taken into account. With chromosomal pathology, the karyotypes of the parents are taken into account. In multifactorial diseases, statistical data are taken into account. Diseases with unconventional inheritance. Cytoplasmic inheritance, the risk of transmission from the mother. Genomic imprinting diseases, the risk depends on the gender of the parent. Diseases of the expansion of repeats, the risk depends on the number of repeats. Genetic risk, the likelihood of a family member developing the disease. Risk of developing the disease, more than 5% is considered low, from 5 to 10% increased, from 10 to 20% average, above 20% high, but a high risk, for example, polydactylia, or a high risk of mental illness, is not even the same thing. The final stage of counseling is to communicate the results to the family. The diagnosis and the percentage of risk are reported only to parents. The conversation is given as much time as it takes. Adaptation of the family to the diagnosis can take from 2 months to 2 years. The decision of further childbearing is made only by parents. The purpose of counseling is for parents to make an adequate decision. Possible solution of parents: give birth, do not give birth, adopt, break up the marriage, give birth from another partner, apply donor germ cells, to give birth but with prenatal diagnosis. Prenatal diagnostics. Methods of prenatal diagnosis: preimplantation diagnosis, non-invasive methods like ultrasound examination. Invasive methods: there is a risk of termination of pregnancy, chorion biopsy, 10-11 weeks, and others. Preimplantation diagnosis. During in vitro fertilization, blastomeres are taken at the morula stage and studied before implantation of the embryo. The first babies were born in 1990. In Russia, it began to be carried out recently. Non-invasive methods: ultrasound, examination of maternal serum, hormones and fetal DNA. Here you can see how invasive methods are performed. Chorion biopsy at 8-10 weeks of pregnancy. In the second trimester of pregnancy, it can be carried out. The procedures are carried out under the supervision of ultrasound. What is the risk of termination of pregnancy with invasive studies? The biopsy material obtained during invasive sampling is examined. Cytogenetically, biochemically, by methods of DNA diagnostics, the doctor informs the family of the results. Based on the results, the family decides whether to continue or terminate the pregnancy. DNA diagnostics of hereditary diseases is the most adequate and accurate diagnosis. About 5% phenotype are described in the OMI. Molecular defect is known for more than 3,000 of them. Diagnosis is possible even if the gene responsible for the disease is unknown. Treatment of hereditary diseases. Is it possible? There are two approaches to the treatment of hereditary diseases. 1. Gene therapy is a radical elimination of genetic defect for the treatment of both the patient himself when transferring cloned genes to somatic cells and the prevention of the disease in his offspring when the transferring genes to germ cells. Phytogenetic and symptomatic therapy are the attempts to normalize disorders without direct impact on the underlying genetic defect. Diet therapy, with the exception of intake from food of those substances whose concentration in the blood is increased. Replacement therapy, surgical correction of birth defects, etc. PKU is diagnosed in the maternity hospital with the help of neonatal screening. Screening of all infants for the presence of biochemical disorders. Currently, children are being tested for the presence of phenylketonuria, cystic fibrosis, congenital hyperthyroidism, adrenogenital syndrome, and galactosemia. Thank you for the attention.